My name is Professor Deliwe Rene Petlu. I'm the TB Program Manager at TB HIV Care. Today, as we commemorate the World TB Day in KwaZulu-Natal province, we will be talking about the importance of TB as a disease that is curable, but we are still having a problem of people dying because of TB. So in terms of the cases that we are having in South Africa right now, the prevalence study shows that 57% of people have been screened and diagnosed using TB X-ray instead of only the sputum alone. So the National Department of Health, under the Global Fund, which is the funder, have procured X-ray machine, as you can see in the background, which we would be using to screen TB among people who normally do not have signs and symptoms. When you go to the clinic, and in most cases people get to be screened for TB, and they've been asked about whether they cough and if they are having a problem with weight loss. But we have realized that is not the only indicator that people will be having TB. So it is important for us to be able to get as much people to prevent the spread of TB by using other alternative initiatives with regards to finding the disease. So if you look behind me, we've got the mobile TB clinic, which is an X-ray unit. And this X-ray unit is meant to be able to help us identify TB amongst, importantly, people who do not have signs and symptoms. So I will take you through inside to show you how the X-ray machine works. And this, as I said, has been funded by the Global Fund, which has actually funded the National Department of Health. So I will help you walk through, and you'll meet the team, which is the people who start by taking the screening. Because before we even do the screening for TB, we do the combination of COVID screening and TB screening at the same time. And then from there, we use an electronic system which actually shows how the patient flow happen between when we start doing the screening right inside the container itself. So if you don't mind, I'll take a walk with you.
My name is Londiwe Buthelezi. I'm a radiographer and I work for TB HIV Care. Today I'll be taking you through the process of the X-ray container, which is used in TB screening. This shipment container has been converted to a medical diagnostic imaging tool, which is used for screening TB. This is a complex unit, but it's very friendly to work on. Patient comes through the X-ray room door, and then the patient will come in with the barcode, which we scan. We use the scanner to scan the patient's barcode, and the patient's details will automatically appear on the system. And then we confirm the patient's consent, which is that the patient gave consent to have an X-ray. This is our X-ray room. We have an erect bucky where the patient is positioned for a chest X-ray for TB screening, and this is our X-ray tube. And I have an X-ray tube stand, which can be aligned according to the patient's height. And this is the X-ray table, which is used for imaging of babies and other examinations. And this is our change room, which is used for patients to change. And here we have our hand washing basin, which can be used for washing of hands. As you know that we need to adhere to IPC standards for infection control. And we have a good air conditioning system because the room temperatures need to be kept cool at all times for the equipment. Our rooms also have a first aid kit box. This is our lead shielding, which is used for protection of patients. As you know that we need to adhere to radiation protection standards and protect our patients from radiation. This is our fridge, which is used for storage of sputum. And then this is our QAI, which uses artificial intelligence to interpret X-rays. We also have a CAD system, which detects TB. Once the patient has been examined, the image will appear on the workstation here. Then the image is transferred to this workstation. Once the image has been transferred from the workstation to the QAI, which is the artificial intelligence, it will be interpreted and all the findings will appear on the system. If the software detects TB, then the software will advise that there is TB, and if there is no TB, it will appear as not advised. Then for any findings that are not related to TB, then that patient is referred to our medical officer for further investigation. This is our printer. For abnormal findings, those x-rays are printed and those x-rays can be sent for referral for further management. Our system needs to have a dedicated power supply. Should there be no electricity, then we have a backup system. We use a generator. This is our battery box. Our batteries need to be fully charged for the power supply to kick in.
My name is Bongegile Ndlovu, ENA of TB HIV care container. We're mainly doing screening with the X-ray. I welcome my patient, then I explain the procedure that I'm going to do with the patient. As we are doing a TB screening, but we always do COVID because as I'm having my laptop, it's having both sides, both screening of COVID and the screening of the TB. When you already register a patient, you ask the patient details, all of the patient details, and then you log in, and then you do a screening for COVID. When you're doing a screening for COVID, and then the person says yes, maybe to 2 of the questions of the signs, she got the signs and symptoms of the COVID. So the system doesn't allow me to continue because the patient with the COVID signs is not allowed to go to the X-ray. We just tell the patient that he must wait at home for 10 days. He must do it. We refer to the, if we are working in the facility, we refer to the nurses who are checking the COVID. So then we'll tell the patient that he must go home and sit at home for 10 days, then she can come back. But if the person hasn't got the signs and symptoms of the COVID, then we proceed with our screening. We go to TB screening. We ask the questions if have you coughing for more than 2 weeks, loss of weight, all the signs and symptoms of the TB. Then the person, even if she says she doesn't have the signs of TB, because we are focusing or we are looking for missing cases of TB, we just send the patients after we've done. After we have screened the patient, we just give the barcode. So the reason why we're giving the barcode is because even if there are some people who have the same name and the same name, because sometimes when we're working there is a queue. So when we got the barcode, we just put it in the arm of the patient, then the patient will go. And this barcode is already here, appears here. We just put it here. We just scan the barcode before the patient went inside. When the patient is inside, then the radiographer will just scan and they see that this is the right patient. It's the way of good identification of the patient. So then when I finish with the patient walks in to the radiographer to take the picture. Once the patient is out from there and the X-ray has an abnormal X-ray, the radiographer sends the patient back to me so that I can take the sputum. Okay. As you see here, I've got the buckle. I just write the buckle, all the information of the patient, and I fill this N1 so that I will send it to the lab. And I also fill TB registration, TB identification registration, so that we can be able to trace the results when they are ready.
Once the registration is done, then the information is transferred to the server. The patient comes in the X-ray room. The patient's barcode is scanned. The patient's details will appear on the system. The patient's name, surname, age, gender, the examination that is required, which is a chest X-ray, patient's ID number, and also a barcode which is scanned by the software. The patient is positioned in a PA projection. So the patient stands with the chest against the erect bucky. The patient's chin must be here. Then I center my X-ray tube, collimate my cones. Need to ensure that the X-ray room is closed during exposure for patient's confidentiality and also for radiation. This is our intercom for communication with the patient inside the examination room. Don't umoya, ukhiphe. Don't umoya kakhulu ubambe. Phefumula kahle, sekuphelile ngiyabonga. Once the exposure has been done, the X-ray image will appear on the workstation, and then I'll do my image processing. For image processing, you can modify your image. You can make it lighter if it's over-penetrated, and if it's under-penetrated, it allows you to make the image darker for diagnostic users. Then you save your image. The send button is selected to transfer your image to the QAI system. After the patient's information has been transferred from the workstation to the QAI system, it will appear on the screen, and then you can view your X-ray. And then the system will show you if the image is normal or abnormal. These are the findings. No significant lung field abnormalities detected. Pleura appears normal. Heart appears normal. The mediastinum is within normal limits. When the patient's image is normal, it will appear on the top left. If it is abnormal, it would also appear on the top left. For abnormal X-rays, we print them. Abnormal X-rays that are TB related, and for any other abnormal findings that are not related to TB, it could be heart-related condition, then the patient is referred to our medical officer for further investigation.
Sanibona, igama lami nguJabu Wanzimande. Namhlanje bengithi ngizonitshengisa ukuthi how we process our GeneXpert, which is a TB testing. We use a machine which is this one specifically is a GX4, it's an Ultra. So at the lab, when we get a sample, we'll get a sample which is labeled with a form. We need to check that the sample and the form match. That's the most important thing, so that we do not give out incorrect results. So once you've checked this, you take a sample. This process is usually done under a biosafety cabinet because this is TB. So what we do, we take our sample, we add a buffer. You add it onto your sample, mix it up. You need to time this for about 15 minutes. The buffer needs to be in the sample for about 15 minutes. After the 15 minutes is over, you take the sample and then you use this cartridge here. This cartridge is called a GeneXpert Ultra cartridge. It is used with the same instrument. You take out your cartridge, your sample has been standing for about 15 minutes. Open it up. You need a pipette. You open up your cartridge, suck up about 3 ml of the sample, okay? And you put it in there, close it up. Once this is done, you ensure that you don't touch the back because it's a very sensitive, this is where the measurements happen. You take your sample and on your instrument, you need to switch it on, open it up, put your sample in, you close it up, and in about 15 minutes, your results will be out. What we do is we have, NHLS has a system where the results transmit directly onto our system. It's called LIS. And so you don't even have to check how the results are. They will transmit directly onto your LIS, and all you have to do is authorize the results, and they are available immediately for the doctors and the nurses.
TB is a curable disease, and it's going to be very important for all of us to play part in making sure that we share information with everybody and the importance of testing for TB, particularly at this juncture where there are other innovations excluding taking only sputum. It is going to be very important to know that the National Department of Health has other resources that can help. One of these being the X-ray machine. And the X-ray machines will be placed in different spaces. They will be in facilities, and at other points they will be in communities. So anybody can walk in, go and take the X-ray. You don't have to have symptoms, but you can come in and you can ask to be tested for TB using the X-ray. It is important to remember that communities need to know that TB is curable and we can win this battle. Thank you.